social determinants of health. Just going to quick check questions. Okay. Alright, so I'll just maybe answer a question before we go into the social what? Yeah, the social health part. So we have a question. So what kind of materials like notebooks, folders should we get for our first year undergrad med? Are there particular materials which helped you study? Yeah, so I really recommend that you get so notebooks are really useful. You'll see with a lot of classes, but it like was even like pre-COVID where a lot of the classes were run in person. Even pre-COVID, like a lot of the work was done on computers, and that's because a lot of the old important resources are now online. So there's a couple of things that you'll hear about, including something called ETG and AMH, which you'll get introduced to quite early. They stand for the therapeutic electronic, which is the E, therapeutic guidelines, so ETG, and AMH, which is the Australian Medicine Handbook, and they're essentially all full of medications that you can talk about, um, and they're really good because they're online, they're really easily accessible. So I would say if you're the type of person who likes to write things down, I know in first year med, I wrote everything down on like a notebook. I wrote everything down on sheets of paper because that's just what made me happy. And it made me happy to see all my notes like that. So definitely something you can do. There's also something called Notion as well, which is like an online program which you can type and use in as well. I know a lot of people use like their iPads to write on, but I would say you overall the most amount of worksheets you'll probably get are during the tutorials and during like the workshops, which are kind of focused. So the tutorials are like small group and the other one's like a big group. I would say with lectures for most universities it will be recorded, and if it's recorded, they're unlikely to provide you like handouts or anything like that during lectures just because of the amount of people who turn up and just too many worksheets to give out. So I would say you can basically bring whatever you want, like a notebook for like I would say depends what type of folder and depends like what you're going to try to do with that folder, like organize the sheets, that's fine. But I would say maybe just bring like one notebook, but you can kind of vibe it out whether you prefer using your notebook or your computer. But I would say definitely you have to bring some type of technology of some sort and maybe a notebook, couple pens. Um, yeah, I think that other than that, you don't really need to bring too much more than that. It's not very like you just need to bring yourself. There's a couple classes which you might have throughout the year which you do need to bring specific things for, and they'll tell you. So things like we'll talk about later during the lecture, clinical skills classes or skills which are focused on professionalism, which you're practicing your skills that you'll learn, like talking to patients and that type of thing. In those types of things, you might need a, I would say buying a stethoscope is a good investment in general. So the stethoscope is for anybody who doesn't know, it's like that thing where the thing that you wear, which like connects to your ears and people listen to your heart using it. I would bring up a picture, but I'll show you a picture once the lecture is done. I'll just put it up on the screen. But essentially, it's just like a steth. It's just the thing that people use to listen hearts and lungs and all that wonderful organs. But I would say that is a worthy investment to make because you will use it during your clinical years. You will use it when you're a doctor as well. So it's like quite expensive. So they're like 100, 200. They can go up to like 400 or something. Don't get one which is too fancy. You probably don't need it. But just get one, like a good basic one, a good sturdy one, and you'll be quite set. I would say you can probably delay buying that until at least halfway through first year med though, because you probably won't start doing any of the hands-on type stuff until that time. But by all means, I think that's a worthy investment to make. But yeah, I think technology, a steph at some point. You might need to bring a lab coat in if you have any lab classes, just to make sure your clothes don't get dirty. And if you have any dissection classes as well, we don't want anything getting on your clothes, or and we also want to make sure everything is clean as well. So that type of stuff, and then you can bring like notebooks, notes, whatever you really want, and that will help just kind of get the stuff done. But yeah, and any particular materials that helped me study. So I think the best thing that will study, honestly, is people who have gone through the course and the materials that they produce. So a lot of universities will have peer programs, and in those peer programs, they'll be able to provide like revision resources and things like that, which really supplement the lectures. And another thing is the tutorials are normally structured so they help you revise the things you learn in lectures. And why that's good is because essentially in a lecture environment, you're just sitting there and trying to absorb things. But in a tutorial environment, it kind of gets you to think about different things which might be going on. Um, but most importantly, I think materials which help the online website, so AMH, ETG, are really helpful. For anatomy, there is so much anatomy resources out there. What I would recommend most is get a really good anatomy book, right? And they will be it will be amazing. You will love it. You will be happy. That will be your like life goals. And get some anatomy flashcards as well once you start learning anatomy, because those are seriously so good. They just help you revise, help you actually go over the things, help you see it visually. And there's a lot of 3D models of anatomy online, which you can kind of dissect, move different things around, see how different things interact. And those are super useful as well. And there's also something called Teach Me Anatomy. There's also Teach Me Surgery as well. And those two websites are absolutely amazing because they help explain things and help talk about different structures in the body. They help talk about problems that can occur with the structures, so you can talk about those as well and kind of relate it to how you might see it in a person. Um, Other types of materials that helped me study were, I would say, like all those like different timers. So it doesn't really matter what technique you use, but I feel like a study timer is good because you'll find that things can get a little bit dry sometimes. You have to like break up your study quite a bit. And otherwise, I would say, oh, things like, so a lot of people swear by something called Anki, Anki, and people like it. I haven't used it terribly, terribly much, but I feel like if you can get used to making, it's like a flashcard system. So the idea of Anki is you do a flashcard and it's supposed to give you spaced repetition. So you do one flashcard and then you say, okay, I'm happy with it or I'm unhappy with it. And based on your response, they either delay when they give it back to you or they give it back to you straight away, depending on how much you want to learn it and how comfortable you feel with it. So I feel like that's really useful, especially if you start using it at the start of the year. I definitely didn't use it during my pre-clinical years, but once I went into clinical years, I used it quite a lot during, especially third and fourth year, because it was really helpful. But I think if looking back, it would have been a useful resource regardless, and especially for medications, because it can be really hard to remember medication names, what they do, because it just doesn't associate in your brain. It's so different to the other stuff you've been learning so far. But yeah, flashcard apps as well. I used Quizlet for my flashcards, so I didn't use Anki. But Anki, I feel like if you can make your own flashcards and get familiar with it early, it's really good. Cool. Alright, I'm going to tick this one. Okay, I'm going to answer that other question later. We'll talk about social. Ooh, just press something. We'll talk about social health and then we'll get back to it. Okay, so um, two things before of so social health is the last thing we'll talk about without breaks. I'll maybe talk about this and we'll take our break. Okay, so social health is kind of the other half of the coin. So population health is kind of looking at how we can better the health of a population from a quantitative type of perspective. So what are the statistics? What is the evidence to support putting in something new and how do different things affect people's health? And we can look at the numbers on that. Social health, and we in our one it was called human knowledge and society. So different people, different schools will have different names for this, but the concept is the same. Essentially what you're looking at is how somebody's health is impacted by their social circumstances and how their social circumstances can impact their health. You'll get probably a whole glossary of terms which you will interact with and learn, but we won't delve into those ones because it's just more memorization and using it in conversation. But in terms of the structure of the classes based on this, you'll have lectures on it maybe, and you'll have also small group tutorials on it as well, just to kind of discuss the issues. Because just like the ethics and law, social health is a lot of the kind of small group activities. They're very focused on you expressing your own thoughts on it and expressing the complex, what you think is impacting a person's health. So this is kind of the bubble that we see quite a lot. So it's kind of a person's health is influenced by core factors and then it gets influenced by other things as well. So if we just try and talk about one of these factors here, right? Let's say we talk about education and how we're educated, because that's really important, right? Because right now we're trying to be educated in something. So, in terms of education, somebody's working conditions and education. So somebody's education, right? If we get good education and supported education and we are able to go well during our schooling, we are more likely to get employed, get work, go to university, etc. Right? If we have a supportive environment where we can kind of pursue education, we're more likely to get work and kind of get higher order work as well. So work which might require which requires training or which requires a university course or a TAFE course. So something that requires learning before you go into it, because often those jobs will be a bit more higher paying than those jobs which don't really require any pre-knowledge going in, right? So this will affect our socioeconomic status, right? Because with those higher paying jobs, we're more able to support ourselves, more able to kind of support our living circumstances, our living environment, right? But then this socioeconomic, so our ability to finance, especially in like Australia, where we have a public-private system for healthcare, that's going to impact our ability to access health, right? Because if we have more money, we're more likely to be able to access both the private and the public aspects of health, right? So that affects our health. But then if we think of it as a cycle, if initially a person and if we think of like this person and let's say they had poor socioeconomic status and then for poor health, and that kind of impacts. So then you have poor health, right? And poor health can then kind of spiral into not being able to work as much, which kind of exacerbates the situation of not being able to earn enough money to sustain your lifestyle. And then that might go on generationally because now that person might not be able to support their child in pursuing education, might not be able to provide them enough financial support to pursue the education or enough time at home that they are able to say, I can support you for so you can go to TAFE, go to university, go to whatever you want. They might not be able to do that. And that kind of spirals into the next generation of people. So you can see that there's a lot of to talk about, and you could pick any aspect of this and you can talk for ages and ages on it. And you can also look at like issues in the media and issues kind of just any health issue in general. And you can just talk a lot about why things are occurring and what's going on, right? And you can kind of debate back and forth about what's the most important thing, what's the chicken, what's the egg, essentially.